pin and release technique for the sternocleidomastoid or SCM muscle. So your sternocleidomastoid runs from your mastoid process behind your ear at the base of your skull here, down towards your sternum, which is the sterno part, and your clavicle, which is the cleido part. So this muscle is superficial, so it's right under the surface of the skin, and you can like grab this muscle on most people. Like this is that muscle, this is what we're looking for. In some people, this muscle tends to do a little bit too much, holds a little bit too much tension. A lot of the times that's because people are breathing a little bit more with their sort of like upper shoulder muscles and maybe even with their neck a little bit. This is a helpful technique to help calm down the SCM muscle so that you can learn how to not overuse it as you're breathing and to get some pain relief essentially. Since this muscle also runs close to where the vagus nerve runs, which is one of the big nerves that helps regulate our parasympathetic nervous system, this can also be really relaxing and helpful. What you're going to do is you're going to get a grip on your sternocleidomastoid muscle. Again, you're looking for a muscle at the like sort of front side of your neck that you can just grab and pull away a little bit, and you're going to grab it, gently pull it away from the other muscles that are in your neck, and then you're going to turn your head to the side. We are just looking for some stretch here and some intensity here without this being terrible, essentially. So I want this to be, if we're on a scale of 0 to 10, where 0 is nothing, 10 is the most intense, I want it to be a 7 at most. Anywhere from like a 5 to a 7 is good here. That's sort of the intensity that we want to go. So we're grabbing, we're pinning, and then we are turning to help mobilize that. My hand is staying still as I do this. And you might find that some places are a little more tender versus other places. For me, right up near my mastoid process behind my ear is kind of achy. So I'm going to stay here for a little bit and hang out. And you can move your head to the side and sort of rotate it a little bit. As well as you can hang out here and just like pull that muscle away a little bit from the muscles underneath it. Again, this should feel good. It should feel better afterwards. If you don't feel better afterwards, you feel more tense afterwards, you might have used too much pressure, and in that case, do less next time.